Thank you all for joining us today. I'm part of the Child's Drive team, and on behalf of Child's Drive and the families we serve, we're thrilled to have you here today for Dr. Lelach Rave's session about kids through the pandemic. Dr. Rave is a first-generation American. She was raised in the Midwest, completed undergrad studies at Northwestern University, medical school at Washington University in St. Louis, and pediatric residency at Cardinal Glennon Children's Hospital of St. Louis University. For the past 13 years, Lelach has been practicing primary care pediatrics at the Everett Clinic, as well as working extensively with the Washington chapter of the American Academy of Pediatrics. As a board member and chair of the legislative committee, Lelach has helped create the Children's Mental Health Work Group, established Medicaid payment for developmental and autism screens for children, and established a single phone line referral resource for children with behavioral health needs. She has also advocated for paid family leave, to raise the legal age to purchase tobacco and nicotine products to 21, and promoted gun safety. Today, Lelach is working to become the first pediatrician to serve in our state legislature in Olympia. She's running for an open state House of Representatives seat in the 46th Legislative District to represent Northeast Seattle. She's hoping to center the needs of children, youth, and their families in policymaking, bringing the thousands of stories, struggles, and triumphs families share with her to the policymaking process. Welcome, Lelach.
Thank you so much, Snow. And thank you, all of you guys, for being here. It is really tremendous that we get to gather today in support of such an amazing organization. So thank you for Child's Drive for everything that you guys do. And it is really an honor to be able to share a little bit of what I've seen and experienced through the pandemic with the children that I care for. To start us off, though, we are going to do a quick poll, and hopefully you all see on your screen in front of you. I'm hoping that we'll know who all here is in the room. So both what hat are you wearing, and you may wear more than one. So for example, I always feel like I'm wearing both my physician hat and my parent hat. So if you wear more than one, I'm not asking you to deny any part of your identity, but give me a sense of how you're coming to this today, what your curiosity is. Similar in terms of age ranges that you work with. You know, I have a preteen and 2 teenagers at home. But if you are specific, if you are an early learning person or a middle school social studies teacher, let me know that too, and let us all know so we kind of have a sense of who's in the room and where we want to focus our energies today. So looks like about 70% of you have responded. We'll wait a few more moments and hopefully get everyone to give their input. Looks like many, many folks are wanting to wear their parent hat, which I completely get. Feel free to check whatever boxes feel right for you for this morning. All right. We're in the mid 80s. All right, I'm gonna give you guys 5 more seconds and then we'll close it. All righty. And this is where we're at. So quite a few folks who are hoping to present or to come today as parents, almost half of you, and evenly split between early learning and other. If anyone wants to put some other comments in the chat box, Snow can let me know what that is. And then it looks like most of our folks here are looking towards younger and school-age kids, not as many folks who are working with our tweens and teenagers. So good to know. All right. And
got one non-parent family member in the chat.
Fabulous. All right, good. So that gives me and all of us a sense of who all is in the room here, the virtual room. So let's get started by talking a little bit just about the pandemic in broad sweeping generalities and then jump in a little bit more specifically. I'm going to start with some numbers and some statistics. How many kids have had COVID? How many kids have actually been directly impacted with this disease? The estimate is about 12.9 million kids in this country have had COVID since the start of the pandemic. And just for some context, that's about 19% of all cases that we've had in the United States. And when you think about kids as part of the population, kids under 18 make up 22% of the United States populace. So a little bit less than their percentage in the population have had this disease. Maybe more important is the severe outcomes. So we've had about 900 deaths of children from COVID since the beginning of the pandemic. And I'm saying about because those numbers are derived from individual states, all of whom report statistics a little bit differently. Some states include 18 and 19-year-olds, and that kind of skews the numbers a little bit. I think more important even than that total number, though, is the fact that about 20% of those deaths have occurred during this most recent Omicron surge. The idea behind, what the suspicion is behind that, is that Omicron seems to have impacted smaller airways more. So upper airways, little airways in the lungs, that ends up looking like croup or bronchiolitis, which are disease processes that can be dangerous even prior to the advent of SARS-CoV-2. So we're seeing a real sharp increase in mortality in these most recent months. Now, I think probably even the scarier number for me, though, is about 250,000 kids, about 250,000, have lost a parent or a caregiver to COVID since the beginning of this pandemic. And sadly, we know that Black and Hispanic kids are about 2.1 times more likely to have suffered a loss than white kids. So we have a lot of children out there who are hurting and grieving because their lives have really been upended in many, many ways from this tragedy. It's been upended in terms of lost time with school, lost academics, lost social emotional opportunities, difficulties accessing the really basic needs of life. Kids who depended on schools for things like meals went through a period of time where they might have had increased food insecurity or other losses of basic social supports. And we've also heard about things like increased abuse in families where there haven't been those supportive outside adults to notice and to report and to intervene. So lots in different areas in which children have been impacted by the pandemic. And the honest to goodness truth is there's a lot that we don't know yet about how kids have been impacted. I am sure that there's going to be many a research paper done by many a graduate student this year and years into the future as folks are really digging in here and trying to figure out what all the long-term impacts have been of this time period. And the other thing that's important to know as we think about the research that I'll be talking about is that research itself has been impacted by the pandemic. Many labs were shut down for a long period of time. Or if labs were open and still interacting with kids, they were interacting in different ways. So how does it impact a child if you're doing research and you're wearing essentially a hazmat suit, right? Does that child give you data or give you different results, and do you get different data because of the way that research has been done? So with all those caveats, let me share with you a little bit about what the research has shown and what we have learned about how kids are being impacted by this pandemic. There's a recent study that came out of Brown University looking at toddlers ages 12 to 16 months, and they were comparing the vocalizations, the words and other sounds coming out of these kids' mouths, and also the back and forth exchanges that they were hearing between these kids and their parents. And they found fewer vocalizations and fewer interactive exchanges with kids born since the beginning of the pandemic compared to children born prior to the pandemic. There was a drop both in verbal skills and in motor skills. Now, sadly, they found that there was even more of a drop of children from lower socioeconomic backgrounds. And in some ways, this is not a surprise. There has long been research. There was a famous study back in 1995 that showed that children from lower socioeconomic backgrounds heard about 30 million fewer words by the time they entered school compared to age-matched peers. And so that economic discrepancy has long been known, and it seems to be playing out again as we look at development of children during the pandemic. There's a famous quote that I like that captures this well, which says, "We're all in the same storm, but we're in different boats." So some people are in little dinghies that maybe are springing leaks and you're hand bailing, and other people might be in really fancy ocean liners. And the type of boat that you're in, even though we're all in this same storm, impacts how you weather it and how you come through on the other end. So we are seeing some research that shows concern for delay, both in terms of language and in motor skills with our youngest kids. The researchers from Brown did not take a look at the question of why, but they have suspicions. And they wonder if it is perhaps the state of the caregivers, the stress that parents and other caregivers are under, that is impacting the way that they are interacting with their kids. If we go on to 3 to 5-year-olds, what we're hearing from teachers in preschools and in kindergartens is that kids really haven't been socialized, and they're kind of starting from square one. They're learning how to sit in a chair. They're learning how to stand in a line. They're learning how to share. They're learning how to take turns. The good news with that group, however, is that honestly, kids before the age of 3 aren't doing a whole lot of collaborative play at baseline. They're mainly doing parallel play. And so while they are a little bit behind, there's every reason to believe that once they start utilizing those new social skill muscles, they will grow and strengthen, both because kids are resilient and because their brains are really plastic, meaning they're really adaptable. And so we have high hopes that as these kids are getting the experiences that they may have missed out on earlier in the pandemic, that we will see some real catch-up growth. A big question that has been asked around younger children is, what is the impact of masks? Does it impact their ability to understand language, understand emotional cues? And there's been some really great research done by the same team that did the still face experiment, which I imagine many folks, just based on the poll results, folks who work with younger kids are probably familiar with the still face experiment. Briefly, for those of you who aren't, this was an experiment done where they put an infant and young child in front of a caregiver who was really told to have a very blank, still face, not to respond to bids from the infant for attention, bids for smiling, bids for any sort of interaction. And the research really showed that kids will try and try and try, and yet at some point kind of give up and shut down if they don't get feedback from their parent. So very famous set of experiments. Those same folks have looked at how kids are interacting with caregivers with masks. And thankfully, they're finding that they do really well. And actually, it's comparable in terms of the difficulties they have with picking up social cues to the same difficulty that they have if the caregiver is wearing sunglasses. So if you think about all the times that we interact with our kids out and about wearing our sunglasses and we don't sort of think twice about it, it really is reassuring that the masks are not the hindrance that some people had feared that they might be. I want to briefly touch on older kids just because we have some folks who are interacting more with preteens and teens. There, the concern, and I'm sure you've heard it in the media, is about mental health. And I just read an article this morning that suicide rates in 10 to 19-year-olds have gone up 10% since the beginning of the pandemic. And so we are absolutely seeing that our older kids are hurting and suffering. And in some ways, it is a no-brainer. the whole task of being a teen is about differentiation, about creating one's own independent identity, separate from your family, separate from the folks that you've grown up around, and really to coalesce around your peers. And then we took a whole bunch of kids where that was their developmental task, and we stuck them at home with their parents and their families for 2 years, and they didn't have the access to their peers. And so it makes a lot of sense that when we have really hindered the developmental task of these young people, that there's going to be consequences and that they are going to really suffer from that. Especially we are seeing with these teens who have not had a sense of control, which is again part of that whole developmental task. How do I take control of my own life? That we are seeing disorders that center around control. We've seen a huge uptick in eating disorders, for example. So teens who are feeling like everything else is out of control, I can't, actually control anything. I can control what I put in my body. I can control how much I exercise. And so sadly, we are really seeing an uptick in those sorts of disorders with young people as they are emerging from this pandemic. So now that I've really depressed you, where can we possibly go from here? We don't know how all of this is going to play out, and really what we're doing is we are guessing and extrapolating from how kids and teens have gone through other disasters, other highly disruptive events. And there the research really goes along the lines of what is toxic stress and how do we buffer toxic stress. So whenever one is in a stressful environment, our brain, our nervous system is bathed in chemicals, neurotransmitters that our body releases when we are stressed. And those completely impact our biology and how we get through these things. The good news is that there are plenty of studies showing that kids can get through horrible things, divorces, deaths in the families, natural disasters, and can come through pretty well if they receive the correct and appropriate and adequate supports. And so healthy relationships, responsive caregivers help buffer the effects of all these hormones of toxic stress. And so really what I'm seeing, and I'd be curious if you all are seeing the same thing in your practices, is that the kids who seem to be doing the best are those whose parents are handling this the best. So if parents are able to weather these storms and keep themselves cared for and centered, their kids are coming through in much better shape than the parents who are very understandably maxed out and stressed out. And so the real heroes of the pandemic, as I see it, are the parents and caregivers who are working with and supporting children through this really unprecedented set of stresses. And that is very heartening and also puts a lot of stress on parents. And I know about half of you are in this room thinking, okay, I've got my parent hat on primarily. And it is my belief that if parents and caregivers are the key to our children getting through this, we have to adequately support them. We have to, as we think about policies coming through this pandemic, make sure that we have adequate paid sick leave. We need to have adequate unemployment benefits. We need to have a robust childcare system so that we can help parents do the task that only they can do and that they can do so well because of the trusted relationship with their child to buffer the stresses that they're encountering as we go through this really unprecedented time. There is so much that we could talk about, but I also want to be aware of our time and be aware of the opportunity that I imagine many folks might want to share what they're seeing with the children that they're caring for or ask questions of myself or the group. So I'd love to open it up. You can both have folks unmute, right? We have that ability.
Yes.
Or
yeah,
we put questions in chat. But what are you seeing? What are the questions that are coming up for you?
Yes, thank you, Lelach. So we have just a few minutes before the session ends, but feel free to unmute yourself and ask a question. And if there's a question in the chat, I'll wait for a pause in the questions and read it out to Lelach for her to answer. Sometimes when there's a pause, people are typing in the chat. So we'll see. Lana says, thank you very much. Very informative. Let's see. Anyone like to unmute and ask some questions? I'm going to change my view a little bit so I can see everyone.
Good thought. I'll do the same. And I'm curious, if you guys don't have questions for me, I'm wondering, are you seeing, because many of you are working with infants in the 0 to 3, are you all seeing the delays in language and motor skills that the Brown study has pointed to?
So I'm not seeing any questions come in the chat currently. Oh, there's one from Tara. Are kids starting to recover from the pandemic yet?
Well, when we say recover, what do we mean, right? The Brown study that really is very recent is saying that they are not seeing an improvement yet, meaning that they're not seeing that the delays that they're tracking are starting to get any better. They are actually seeing continued delays. So even as there's some normalizing that's happening, whatever normal means anymore, I think that we're still seeing parents and caregivers who are really stressed out and are not interacting in the same way that they may have done pre-pandemic with their youngest kids. And so they are not seeing an uptick there yet. Again, I am hopeful because brains are resilient, brains are plastic, they are moldable. I am hopeful for that, but I'm not seeing numbers that show that yet.
Okay, so there's another question. There's a couple more questions in the chat. One of them is a little bit more related, so I'll read that one first and then I'll read the other one that came up. Aside from supporting the parents, can those of us that aren't the parents do anything specific to help? And then the second question was, do you see an increased rate of homelessness for kids during the pandemic?
Great questions, both of those. So I think that, again, depending on the age of the child, certainly with the older children who are dealing with the mental health crisis that is just profound and overwhelming right now, having a trusted adult in the life of a tween or a teen has statistically been shown to be one of the most protective things. So any teen or tween that you interact with, if they can name 3 individuals outside of their parents that they feel like they can speak with and trust, that having those 3 names, if they can even list them, that is hugely indicative of them having protection. So if you encounter a teen who doesn't have those names, what can you do to become one of those names? What can you do to develop that bond and that trust to be a person that they might rely on? For the younger kids, I think it's about coaching the parents. So if you're not the parent, one of my favorite lines that I tell parents, because I often share the 30 million word deficit stat with folks, I tell them, words are free. There is no reason there should be that deficit based on socioeconomics. You can talk all day long. And I just sort of start chatting away in the exam room with the parent and the kid. You can just say, okay, now we're going to get you dressed again. And I'm pushing your arm through the sleeve. And oh, that was a little tight. And I just sort of show to them, I tell them, you're going to feel silly, but just talk. Just tell them about everything that you're doing all day long. And then give them a chance to respond back to you. And coaching through that, because it does feel a little bit silly to just talk to your infant who's not really responding to you, but showing the example of it and coaching them through the fact that it is not only beneficial, it's doable, it's easy, I think it shows sets a good example.
Mhm.
Homelessness, I didn't even get to. Yes, the economic stresses, absolutely. Um, those of you in Seattle, the homeless issue is huge, but the visibly homeless are not the families that we're seeing. The families are couch surfing, the families are stuck in hotels, the families are living with an aunt one week and a grandparent the next. Absolutely, that is increasing.
So we are just towards the end of our time, but I wanted to, there's a couple more questions that are really important that I think might be helpful to answer. So one of them was, what can parents do other to try to care for our mental health? And does this evidence mean we caused our children's speech delays? And then another question was, you mentioned that there's an increase in eating disorders in teens, which is concerning, and any particular things that can help as a parent that might open the opportunity for that discussion with the teen.
Yeah, so the last thing I want is to have you guys all walk out of here feeling super guilty. You are not at fault for any of this. We are all in whatever boat we're stuck in, all in this storm. And so I think that it is super important. The boat goes down if you're not in it and you're not, rowing away or bailing or whatever your job is in the boat. So self-care is huge. And and I feel as much as we can, and this has been tough, that whole adage of it takes a village. We've sort of been isolated from our villages. We haven't been able to interact the way that we typically do, but do reach out, do figure out who you can find, whether it's a neighbor, someone from the school. Try and reach out and find someone to help you get the support that you need, because it is absolutely true. The boat sinks if you're not there as the captain. Um, and and it's easy in terms of, no, you're not causing your kids delays. Just talk with them. You can do that. Like, everyone can do that. Eating disorders, I think, be attuned to them and reach out for help if you are at all suspicious that anything is going on. And that applies across the ages and across the board. Your pediatricians, your teachers, your social workers, whoever it is that you are lucky enough to have in your life, all of those folks know that this is happening and want to be of help. So reach out if you have any, trust your gut. Your gut's probably right on. You are the expert on your child. So if something feels like it's off, please reach out for help.
Okay. Well, thank you everyone for your questions and comments in the chat, which I didn't read out, but
sorry that we didn't have enough time, everyone.
That's okay. We're so grateful to have Dr. Lelach Rave with us today. And today's virtual conversation is a benefit in support of Child Strive and the work that we do in the community to make the difference in the lives of our young families. So if you can, please help us continue to our important work. We ask that you consider making a gift